Hi, everyone. I'm Dr. Funke Afolabi-Brown, the founder of Restful Sleep MD, and really excited today to be joined by my wonderful friend, Dr. Lam, and we're going to be talking about sleeping kids, what every mom should know. So, Dr. Lam, it's so good to have you. Can you tell us a bit about yourself?
Yes, thank you for having me here. I'm Dr. Loam. I am a pediatrician and founder of Generational Wellbeing, where I help mothers provide them with simple, practical tips on how they can start creating those habits to help change that narrative from disease to wellness for their families. Thank you
Yes.
again for having me here today.
Oh, so exciting. You had me at generational health. That's incredible. And, just talking about habits, we're creatures of habits. So I think already I can imagine because habits really impact our sleep. But, we'll hopefully delve into some of that today. But really, one of the things we wanted to talk about was an example, as a pediatrician and myself also as a sleep medicine physician and a pediatrician as well. One of the common questions that we hear a lot is, my baby is not sleeping. So really, it's extremely as a for someone for a mom who has that the struggles that you might experience with your child not sleeping, it could be very overwhelming. And so really, I'm hoping that we can just have a conversation about some of the things that you can think about. Really, once people talk about sleep problems, we kind of bucket it into different categories, which is something I do with a lot of people I work with. And we start off with, medical sleep problems or medical problems that can affect your sleep. And that's really a huge one. And I'm hoping we'll delve into that a bit today. And then the second piece are more of those habits we talked about. So kind of behavioral sleep problems. So what are the things that are going on around bedtime, around the routine, around the hygiene and things like that that can affect your child's sleep? And then the third is kind of those day-to-day things that are present during the day that's also present at night. So if you have a child who's very anxious or you have a child who has autism or ADHD, that's present all day, every day, right? And so at bedtime, it's not going to go away. So it does play a huge role in their sleep. And so really, Dr. Lum and I just wanted to come here and just really kind of delve into some of those things so that when you hear that, when you say that my child is not sleeping, kind of what other questions you do start to consider and when should you know to seek help to delve into it. So what, in terms of those medical sleep problems, Dr. Lum, in your practice, what are some of the issues that you find that people are faced with in their kids that may impact their sleep?
So with medical, so with any mother who's coming in, of course, we want to make sure there's nothing medically wrong with the child, right? Sometimes it could just be allergies. A lot of times, kids who have like chronic allergies or seasonal allergies, the airways are obstructed, they can't really breathe at night, and that could wake them up from sleeping in the middle of the night from their sleep. Or even they have a hard time, especially when they lay down, everything just sits up there, they can't breathe. So they have a hard time going to sleep with kids who have that. Or even with respiratory illnesses. So, going to daycare, seasonal changes, you have those colds that just don't go away. So that could be affecting their sleep too. Another one is eczema. We don't think about it, right? It's itchy, they're uncomfortable at nighttime. It's just that itch that's not going away. And that could possibly be affecting. So it's really asking the questions or looking at your baby to see, or your baby or infant or child to see. Speaking of infants, Gerd, reflux. Some infants will actually have the silent reflux that they cough at nighttime. So if you have an infant who is just, you notice that at nighttime or you lay the baby on their back and they're just constantly coughing, that's something else to consider and have your doctor take a look at the baby too.
You bring up such a good point. I love the fact that, you're kind of thinking this through from, again, not just the medical, like what are basic things that we may not necessarily pay attention to? And it's interesting you mentioned eczema, that itchy feeling, discomfort. And sometimes kids just really have a hard time voicing, especially when they're younger, voicing that they are uncomfortable. They may just be crying or be restless. And it's interesting too. I did have a patient who really had chronic eczema for so long, was already actually cared for by the allergist. And so when we were talking to what in the world could be going on with his sleep, we were like, oh yeah, he has eczema, but he's on medication. But then after like almost a year of mom not sleeping well, baby sleep on and off, we realized that his eczema was not fully adequately managed. So even just saying, oh yes, he has this issue, but really making sure that it's really well addressed. I think that's a really big issue because it can disrupt sleep. It can prevent kids from falling asleep, and also it can make them wake up frequently. So definitely a huge one that parents really need to be aware of.
Absolutely. And you did mention medications too. Another thing I've noticed sometimes, when there's eczema, where there's allergies, sometimes you want to give them medications for the symptoms. However, some of those medications have side effects. Benadryl will get some people drowsy and sleepy. With some kids, it gets them super active and they can't go to sleep. So being mindful of the medications too is another thing.
Oh, yes, yes, yes. And it's so funny you mentioned that because many times people use that sort of side effect from Benadryl to help their kids go to sleep. And then they're like, I don't know what happened. It now has this rebound energy and difficulty really settling down. So definitely a huge one to be conscious of. How about like things like reflux? What do you see? I mean, especially for the younger kids and things like that. Do you tend to see that impact kids' sleep a lot in your practice?
In infants,
Yeah.
I do see that sometimes in infants. Almost every baby will have reflux, right? And it's easier to see after feeding where you actually reflux and see the milk coming out. But there are some of those kids that have like a silent reflux, and you really may not see it, but you see that's nighttime coughing. So that's
Mm.
something to be mindful of too. Yes.
Absolutely, absolutely. And then when you mentioned coughing, of course, as a pulmonologist as well, which was actually part of the reason why I started to pursue sleep is with asthma as well. How about that? Does that seem to be something you see frequently as a cause of sleep disruption in the kids you work with?
Absolutely. Nighttime cough and asthmatics. I was an asthmatic when I was younger too. So
Wow.
I can say that firsthand. There are so many nights where I just wake up at night, just cough, 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 cough. And then you can go back to sleep and then you're tired, exhausted throughout the day. So yes, absolutely. Asthma and nighttime coughing too. So if your
Mhm.
kid has that nighttime cough, it's something to really have your doctor check them out to see what exactly is going on.
Yeah, that's such a great point. And then, in terms of the medical sleep problems, a lot of what I take care of, sleep apnea is a huge one. I mean, people are always like, what? Yeah, he snores, but do kids have sleep apnea? Yes, absolutely. In fact, the prevalence is anywhere from about 2 to 6% of children. And while snoring may just be from congestion or allergies or colds, again, in children. Sometimes, especially if they have persistent snoring that's still there, like all year round, or they're having restlessness during sleep, or, waking up exhausted, tired during the day, that may be a sign that that snoring is not just, benign. It might actually be a sign of sleep apnea. And so definitely something to watch out for in terms of the medical issues. Something else I tend to see is restless leg syndrome. It's just that weird discomfort that some kids, parents, I mean, I don't know if when I was pregnant, I had a little bit of, of that. But children also have restless leg syndrome. And, sometimes people call it like, could it be growing pains? And let's try to get some Tylenol on board. But if your child is having this like constant discomfort where maybe they're needing to move their legs back and forth before they go to bed, or they actually describe it, if you let them describe it, they'll say things like, it's a creepy crawl, it's a weird sensation in my legs, usually in the legs, really relieved mostly by movements or massage or things like that. But you can imagine if you have an urge to keep moving your legs every time you want to go to sleep, it's going to disrupt your sleep a lot. So those are just a couple of the medical, sleep problems that, we can also see.
Right.
Yeah. So switching gears a bit. So another thing we see is, okay, they have sleep. My child is not sleeping. Usually for some parents, if their child sleeps, a fair amount, but during the day they're perfect, nothing is going on, everybody else is sleeping. In fact, mom is not feeling like her sleep is affected, they're less likely to seek care. Usually they're seeking attention if A, mom is not able to sleep because the child is not sleeping, or B, the child is really struggling, like it's a real struggle where they're waking up frequently. But why is this something that's important for us to address? I get the sort of the latter end when you send them to me, where you kind of like, okay, something went on, something triggered this consult, this reason why the child is referred to see either a sleep expert or things like that. What are some of the sort of the behavioral or the daytime effects that you see in children that makes you think, I think we should tackle your sleep and pay more attention to the sleep piece a little bit more?
Yes. So I usually will see that it's like you said, if the child's behavior is okay, mom is okay, there's nothing wrong, right? But that behavior typically starts out with a school where the kid goes to school, not enough sleep, they're irritable and they're aggressive. I don't know. It's just like, I feel just like if anybody, if you don't get enough sleep, you're restless. And with most kids, they don't know how to name that feeling or the emotion. So they act it out through their behavior. So we see a kid who's just constantly disrupting class. Or the second common reason why I see parents come in is because my kid, I have gone through this information like 10 times. My kid has a learning problem. They cannot grasp it. I mean, if I don't get enough sleep, I'll read the same material like 10 times too.
Yeah, that's so true.
So a lot of times when you start seeing those behavior, irritability, aggression and stuff, instead of really trying to reprimand the kid and say this kid is just very, it's a bad kid, or this kid has issues here and they're really going back to say, let's address this sleep. Let's figure out what is actually causing this aggression, or why can this kid not grasp the same concept we've taught them, multiple times. So those are the two key things I really see in office too.
Yeah. And it's so interesting. One thing that caught me is the fact that it's almost like hyperactivity. You're not necessarily hearing, sleepiness. And so that's one thing that I want parents to really understand. Like, your child may not necessarily complain of, I'm sleepy. I mean, they may fall asleep on car rides and things, but they're actually overtired. And so you get like a completely opposite effect where they're just like hyperactive, they're throwing a lot of tantrums. Typical example is that like toddler in the grocery store just on the floor and the mom is like, he didn't sleep enough, or he missed his nap, or stuff like that. So that's just something that I just want to call people's attention to. As you mentioned it, like, maybe when they're older, they might feel sleepy, but usually in the younger age, it's those learning issues, behavioral problems that we're really seeing in terms of how they manifest. So I just thought that was very interesting.
Right, absolutely.
Yeah. So finally, what about, I know, you do talk a lot about healthy habits. And again, habits are a wonderful part of incorporating healthy sleep, right? So healthy habits during the day is something that you can use to develop healthy sleep routines that can hopefully help you get good sleep. So what are some strategies, especially for younger or school age kids? What are some strategies that you can have families incorporate in their day, maybe, to help them with just getting their kids through the bedtime? Because I can tell you, one of the other issues that during that age is, can I have an extra cup of water? No, it's not bedtime. I want this, I want that. They're running up and down. The family feels bedtime is chaotic. Everybody feels like crap. like crying at the end. So,
Right.
what are some practical things that you feel like even during the day, parents can start to practice actually, so that by bedtime, the kids are kind of used to that routine or whatever it is to help them with transition to sleep or bedtime?
Okay, so during the day, there's several things that come into play. One, I'll start with the activity level. So if the
Mm,
kid is like this hyper kid and stuff, if you want like vigorous activity earlier in the day, you don't want them just running around bouncing and then, oh, it's time to go to sleep, because that vigorous activity actually gets them awake, and then it's like just shut it down, go to sleep. So, start slowing down a little bit earlier. If it's a kid that will like, we have to go outside, maybe a brisk walk outside may just help. Anything that is calming as opposed to something that is super, super active. And then the second thing is just being mindful of what you're eating around dinner time. One thing I've really noticed, especially with parents, when I'm talking to them, like we've done everything, I start by asking, what did you have for dinner? And sometimes we're busy, right? We can stop by a fast food restaurant and we order a meal. And what comes to that meal? Coke. Caffeine is in Coke.
mm,
Or sweet tea, that's a big thing. A lot of people are not really aware that you have caffeine in like sweet tea or Cokes that may be interfering with the sleep. So slowing down, making sure we're not having caffeine or any kind of caffeinated products after a certain time. And then having a consistent bedtime schedule, because, starting out may be a bit difficult, but that consistency is what is going to really help you over time. So slowing down, shutting it down. One more thing, devices, especially with teenagers, oh, I shut it down and I can't go to sleep. I'm just sitting there, because those devices actually wake you up. So it's just like having that slow down, cutting off the devices, having something where it's more of a relaxing activity than anything that will really, wake you up, so to speak.
I love it. I love it. So really looking at activity, um, that is huge because activity and exercise and sports and first of all, wears kids out.
Right.
And it also actually has been shown to increase slow wave sleep. And slow wave sleep is so beneficial to growth, it's beneficial to restoration, to healing. It has so many effects. And growth hormone secretion occurs in slow wave, what you call slow wave or deep sleep. So deep sleep, that's a stage of sleep. And growth hormone is secreted during that stage, which is important because we need our kids to grow, right?
Right.
So I
Right.
love that. And also just the timing of those activities. So while you want them to be active, you don't want them to be running a marathon around the house at 7:30 p.m. or 7 p.m. when their bedtime is 7:30, because then what you get is heat. So they increase adrenaline, their core body temperature increases, and they also have a higher heart rate. And you need the opposite of that for sleep. So while we do activity, I love how you said like earlier in the day, taking a walk or something more calming when it's closer to bedtime. And yes, caffeine is such a huge piece. My goodness, caffeine, heavy meals, sugary stuff just before bed is not really going to set the tone. And so really being careful and really pointing out, even sometimes, even when they say the soda or the drinks are decaffeinated, it doesn't mean no caffeine. So you have to be really careful. And some kids are just really, really sensitive to that. So really helpful that you pointed that out. And oh my goodness, the devices. Like I always say, technology has made the world so much smaller, but it has also caused a lot of issues with our sleep and our minds just constantly going. So really making sure that those devices that we put them away much later. So this is like really helpful, so comprehensive and all that, Dr. Lum. In terms of just any final words you had for us when it comes to this, my baby is not sleeping or my child is not sleeping, what should I do? What are some final words you have for our moms out there who might be struggling?
I would say listen to your baby and really pay attention to the baby, because a lot of times, sometimes we're frustrated and it's just like, just go to sleep already. What is going on? But sometimes when you listen, your baby has the answers. Like you said, I think you mentioned with the restless leg, they say it's like crawling. Sometimes they'll say it's crawling. It's like, what are you talking about? So really listening, because they are really finding those words to communicate to you, whether it's via the symptoms or whether they're trying to say it in their own words. But when you start listening and paying attention, you'll be able to really find that, look for and find that cause of their sleeplessness, and you can fix it when you know what is actually causing it.
Yes, yes, I love that. Listen, listen. You're right. You're right. That's so important. And seek for help. Speak with your pediatrician. Sometimes it may take some detective work, some
Right.
process of elimination. Sometimes you may need to get blood tests. Sometimes they may need to do a sleep study. Sometimes they may need some more detailed tests to find out what's wrong. But then again, really paying attention to what you're hearing, I think is a great way to really start that process of getting your child the sleep they need. This has really been awesome. And where can people find you, work with you, and things like that, Dr. Lam?
I am on Instagram at Dr. MD. I also have a YouTube channel where I provide simple practical tips, and we will include the link in the show notes.
Perfect. Yes, all of that will be included in the show notes. And I'm also on Instagram and Restful Sleep MD. Also have a YouTube channel on my website as well. So hopefully between, the resources that we have together, you can really start to establish great sleep, healthy habits, and really start to thrive in your parenting journey, because we're really here to help. Thank you, everyone. And thank you so much, Dr. Lam, for joining us.
Thank you.
Bye, everyone.